Welcome everybody to the Global Nursing Network for Rare Diseases. My name is Sian. Today I'm going to be wearing two hats today. So I'm going to be facilitating today's session and I will also be presenting. So I will be doing both roles. So bear with me while I navigate through doing both. But for those who haven't joined before or haven't met me, my name's Sian Gannon. I'm one of the founding nurses of the Global Nursing Network for Rare Diseases. I am a clinical nurse specialist at the Rare Care Centre in Perth, Western Australia, and I am very fortunate to be with you here this afternoon or this morning, wherever in the world you are joining us. I would also like to say hello to all of our watchers on YouTube. Thank you for joining us, and I hope you sign up to the Global Nursing Network so you can watch these sessions live. Like I said before, we are using Wordly. Sorry, I'll just go back. We're using Wordly. And so if you would like to use Wordly today to translate into your preferred language, then by all means, use the QR code, click the language that you would like to change to, and it should be able to translate for you as we go. If you have any issues, sorry. If you have any issues, please give us a message in the chat. My lovely colleague Sarah is here with us today to help try and navigate the technical difficulties. Please bear with her. This is her first webinar, so please be kind. I know we all will. But I'm just going to crack on with the presentation. So as I said before, we are recording this session today. So if you are watching today and you'd like to watch again, you are more than welcome to. And for those around the world who are unable to join us live, you can watch it on our YouTube channel as well. Please feel free to share with your colleagues because we know that spreading the word around rare diseases is how we reduce the impact of rare diseases on our patients. So as I said before, this is another chance to get the QR code for those of you that need to use the Wordly link. Again, if you have any issues, please message us in the chat and Sarah will be able to help you out. Before we get into the presentation, I just want to do our global welcome, which we do at the start of all of our webinars. As a global network, we respectfully acknowledge the Native, Indigenous and First Nations people on whose ancestral land we gather around the world, as well as the diverse and vibrant cultures they present. And I'd like to take this opportunity, if everyone could put in the chat where in the world they are attending from, that would be amazing. It always amazes me, the different countries that we have nurses attending from. So please, if you can pop in the chat where you're from in the world, that would be amazing. And we're able to connect with everyone in the chat as well. So just a little bit of housekeeping before we start. Just while the presentation is going, if we can make sure that our mic is on mute, just so that there's no interference. We do encourage you to have your webcams on if you're able to, just so that we can see your beautiful faces and make the connection for the name to the face. But I understand with bandwidth that can be a challenge at some time. So if you can, we'd love to see your faces. Like I said, please feel free to utilize the chat. You can pop questions or thoughts in there and we can loop back at the end to go through any questions that we have as well. And discussion is encouraged. This is a community of practice that we're creating. So your thoughts, experience, and opinions are welcome in the webinar today. So we are going to swiftly move into the presentation. I don't need to hand over the mic because it is still me. Like I said, my name is Sian Gannon and I am from Perth, Western Australia. I work for the Rare Care Centre out of Perth Children's Hospital, and I am fortunate enough to be the Education and Workforce Capacity Lead. And I am also a rare disease patient, so I am able to use my personal experience as well as my professional experience and combine them in a way that is thought-provoking and useful from a health professional's perspective. So in Australia, especially in Perth, I would like to acknowledge the traditional owners of the land in which I'm working, the Whadjuk Noongar people, and I pay my respect to my elders past, present, and emerging. So just a quick little start for a riddle for those of you in the Northern Hemisphere to start your day. So who am I? Tomorrow I am surely here. Yesterday I am found as well. Today I am gone. Who am I? Please feel free to write in the chat if you have an idea. I'll give you a couple seconds. I think it only works in English though. The answer is the letter R, so R for rare disease. I like to use that to try and get the cogs moving early in the morning whenever I'm normally doing this presentation. So what is rare? So there's obviously a definition of what a rare disease is, and it is one that affects less than 1 in 2,000 people. So while individually the diagnoses are rare, it actually equates to quite a few people. So there's 9,000 different rare diseases and counting, which in Australia, that is 8% of Australia with a rare disease. Within Perth, for a pediatric nurse like myself, we estimate there's 63,000 children living with a rare disease in Western Australia, which is enough to fill a sports stadium here in Perth called the Optus Stadium. So that number works to around 2 million Australians living with a rare disease. Globally, obviously, it's a lot larger. We're looking at a number more around 300 million to 400 million people living with a rare disease, which is why our work in rare disease is so important. So this is kind of giving us a little bit of a snapshot of what rare diseases entail. Like I said, with 1 in 2,000 people specifies a rare disease. So that's the definition. But what does that equate to? What does that actually mean? Within rare diseases, only 5% of rare diseases have a curative treatment or an altering prognosis treatment. If you think about it in terms of a cancer, for example, for people with a cancer, if you were told that only 5% of cancers had a cure, it's a really big number. And that's what our patients are living with, that number of people living with a rare disease with no treatment able to change their prognosis. With that, 80% of our rare diseases are actually genetic. So we're working with a genetic origin of our rare diseases. So a wider understanding of genomics is really important in understanding and recognizing rare diseases earlier. Within that rare disease, I will be talking about it a little bit more detail later on, but during that journey for a diagnosis, 50% of our patients with a rare disease are misdiagnosed. So they're from the time that they are fine with their first symptom, 50% of those, but until they get to their actual diagnosis, are misdiagnosed during that time. This can lead to inappropriate treatment. This can lead to procedures that they don't need, invasive procedures that weren't required if their diagnosis was correct at the beginning. Within children, again, I'm a pediatric nurse, so a lot of the work that we do is around children. 6 out of 10 deaths within children are from a rare disease, and 70% of all rare diseases actually start within childhood. So that's why within pediatrics, it's really important to bring awareness to rare diseases because there are so many that start to show up within that childhood period. On average, it takes around 7 years to actually get a diagnosis, if ever, from the start of their first symptom. And like I said, we'll be going into more detail about that later on. And unfortunately, health can be seen as a business. So it is about money that is spent. And unfortunately, rare diseases are the biggest cost to the healthcare system. A recent paper coming out of the States showed that 1.5 times greater outgoings for rare disease on the health system than all common conditions combined. So it's a really important demographic that we need to care for to reduce the impact on the healthcare system, but to also improve the experiences of our patients. So why are rare diseases so different? We obviously know that chronic illnesses are cared for within our healthcare systems. We know the burden of chronic disease. So the question is often asked, what is the difference between chronic disease and rare diseases? Well, there are very much a common ground between the two, but within rare diseases, there is specific experiences that are very special to the rare disease population. So with rare diseases, they are often multi-system. So they're affecting multiple organs within the body. That means that then that organ is looked after by a certain specialist, which means that a person will be seeing multiple specialists within their healthcare journey. And that condition, that disease, is often chronic. So it is lifelong, it is life limiting potentially. And so they're not only dealing with the chronic element, they're also dealing with multiple specialists involved as well. Like I mentioned before, we know that there is a long diagnostic journey for our rare disease patients of the average of 7 years. So if you imagine having a symptom continuously for 7 years without knowing what is wrong with you and what is happening to your body, that is a really long time. That is very specific to rare diseases. And during that time, that misdiagnoses, you're going to get fragmented care because the care that you're receiving isn't equaling what your diagnosis needs. And like I said, we've got that lack of treatment options with that only 5% of rare diseases having a prognosis changing treatment. And being a rare disease patient, a lot of our patients report that they feel very isolated because of the rarity of their condition. They're often isolated within their community. They may never meet another person with their rare disease. Their parents may not ever meet other parents caring for a patient with that disease. So there becomes this isolation that they feel that they are alone, that they feel that they're the only experts within that disease. And there's a lot of stigma that they face. Again, we'll go into more detail later on in the presentation. So like I said, I specialize in pediatrics. So there is a greater limelight on pediatrics within rare disease because of the high percentage of rare diseases that show up in childhood. And unfortunately, the numbers aren't great. Like I said, 6 in 10 deaths within children are from a rare disease. And unfortunately, the mortality rate of our patients with a rare disease is 13 times higher than those of common conditions within the emergency department or as an inpatient due to their rare disease. And why I am super passionate about educating around rare diseases is to reduce the gap of that unmet need that was in rare diseases. So we have those multiple specialists that need to be coordinated. We then have the mental health burden that falls upon the family to navigate a health system that they may not be familiar with. We have the multi-system disorders. So we are dealing with that multiple specialist coordination. And we also recognize that rare diseases don't just impact a person's health, it impacts every part of their lives. So what do I mean by that? What do I mean by it affects multiple areas of a person's life? If you think about it for a child's perspective and either as an adult, education can be impacted. The ability to safely attend daycare, to attend a school that is able to support a child's needs whilst they're at school is impacted by a child's rare disease. A school may not feel comfortable taking on a child with a specific rare disease due to lack of education and pathways to best support the child. So you're already reducing that child's access to education, number one, and curriculum, but also social interactions, learning how to make friends, to share, to learn, to eat together. You're being reduced access to something that should be a right to every child. And with the social connection comes that isolation from a rare disease. So there's no support groups potentially. A child may be the only child within the country that has that specific rare disease, and there aren't support groups that are able to connect, to know what path they've walked, to be able to share stories, and that level of understanding. Our patients just don't have that ability. And we know that rare diseases affect a family's finances. So, depending on where you are in the world and how your healthcare system is set up, your patient with a rare disease will increase their outgoings for costings, whether that be from medication, through therapies, through transport to hospitals, to car park stays. All of these costs add up on top of general life costs as well. So we know that our rare disease patients in finances are impacted. And with that as well, our family's ability to work is impacted. So if a child has a rare disease that requires 24-hour care, a parent may need to step back from their ability to work and therefore reducing the income into that household. So the parent who is at home becomes a 24-hour carer and is unable to bring in money into the household. And we can't forget the siblings. Often the siblings fall to the wayside of a child living with a rare disease. The sibling can become part of the caring model. The sibling can also report that they feel neglected, left out, and not important. So it's really important, especially as a pediatric nurse and in a pediatric hospital, we care for the entire family. It's not just the patient that we're looking after. We need to improve the experience for the whole family. And juggling all of that obviously has a huge impact on a person's mental health and well-being. The ability to juggle all of the appointments, medications, management of symptoms, and then facing that isolation and stigma within potentially all of the sectors that they come across, it really brings down the mental well-being of our patients and our families. So, how do we recognize a rare disease to improve the experience early? So, one of our amazing directors, a man called Dr. Gareth Bainham, he wrote a paper on how to recognize rare diseases early. Recognizing them early means a greater chance of an earlier diagnosis, which means that we can improve the care that they're receiving from a very early standpoint. So, he broke it down into the rare disease red flags. So we have the family genes, which is what we want people to remember as kind of the benchmarks to go from when you're caring for patients. So when we're looking at a patient, they've come to you, whether it be on the wards, in a clinic, in a community centre, you're looking at that patient and you're taking the family history, and the family's starting to talk about how their child is exhibiting maybe behavior or features that are very similar to other people within the family, whether that be siblings, cousins, aunts, uncles. You start to hear a pattern of there's been multiple people within this family that have kind of presented the same. So that's one of our first red flags. We then move on to G, which is group of congenital anomalies. So this is when a child may be born with abnormalities within their organ structure, whether that be within their heart, in their lungs, in their liver, but they're born with these anomalies within their bodies. Another red flag. We're then looking at E for extreme or exceptional presentations of common conditions. So this is where it can become really difficult to recognize a rare disease. A lot of the rare diseases present as common conditions. So recognizing that a patient has had multiple presentations with the same thing, whether that be vomiting, whether that be malnutrition, whether that be inability to absorb sodium or potassium, we need to look at the whole picture to recognize that this child has been presenting with the same thing, and the treatment that would normally help with that isn't helping. Again, red flag. The N within children is quite easy to recognize. So we've got neurodevelopmental delay or degeneration. Like I said, a lot of rare diseases present in childhood. A lot of rare diseases, some of their symptoms are around neurodevelopmental delay or degeneration, meaning that a child has learned potentially to crawl, walk, talk, and eat, and then they start to regress. So then suddenly they're unable to feed themselves. Suddenly they're unable to talk. Suddenly they're unable to walk and revert to crawling. Those are red flags for a rare disease because obviously our developmental milestones progress along, and recognizing that a child is stepping back is a sign that something needs to be investigated. Then we move on to our second E, which is extreme or exceptional pathology. Again, these are blood results potentially that can't be explained. So whether that be low white blood cells, high potassium, low sodium, things that have no logical answer or reason that keep showing up regardless of retesting. We want to see that and we want to recognize that as a red flag. And then we have our last S, and it's surprising lab results. So we're looking at markedly abnormal pathology results, whether that be from biopsies, from skin tissue. We're looking at abnormal results. Everything is just a little bit off the norm, and recognizing that a rare disease will more than likely have multiple red flags. So it will have the family history element, potentially also the congenital anomalies, and then also the neurodevelopmental delay. More often than not, a rare disease will have more than one red flag to recognize it as a rare disease. So what does that look like in real life? It's all well me saying, this is what it is, these are the red flags you need to look for. I'm not sure how big this picture is going to be for you, but this is basically a diagram to show the clinical features, also known as phenotypes. So we refer to them as human phenotype ontologies, which basically means symptoms or signs or experiences for the patient. So this breaks it down into areas where the multi-systems could be affected, whether that be in the facial features, so the presentation of their eyes, whether it be close together, far apart, whether their eyebrows are high above their forehead or lower or closer together. We can also look for hearing, whether their eyes are bulging or sunken in. And then you've obviously got the internal medicine side, so lungs, joints, bones, cardiovascular system. These are all areas that someone needs to take a step back and be able to connect the dots for us to lean towards it being a rare disease. So, like I said at the beginning, what's the difference between a rare disease and a chronic disease? So this is a diagram to kind of show how a rare disease is compounding above that of a chronic illness. So we've got challenges common to both chronic complex illness and rare diseases. So we've got inequity of access to care depending on geography. So obviously, depending on where you are in the world, some hospitals may be a day's travel away to some people in very remote towns or villages, or they may not be able to get access because there is no transport regularly to the hospital. And we also have that financial burden that's experienced. We then have challenges compounded by a rare disease. That's our inadequate management that we spoke about, and that fragmented care, the lack of peer support, and that higher mental health impact that we've spoken about as well. But it's the challenges that are unique to rare diseases that is important, which is the defining element of the experience of a rare disease. Rare diseases are not educated as well as they should be, as I would like them to be, and I'm very biased, obviously, being within the rare disease space. But there is a lack of awareness around rare diseases, which then leads to that long diagnostic journey that we've spoken about. We then have that lack of treatment option, and that the patient becomes the expert in their disease. So when they're presenting to a healthcare professional, they will know more than the healthcare professional about their condition, more likely. So this is what a rare disease patient is carrying with them at all times. So when I say that the rare disease diagnostic journey is very long, it actually has a very specific name within the rare disease community, and it's known as the Diagnostic Odyssey. And so the Diagnostic Odyssey represents this turbulent journey that our patients have to go through trying to get a diagnosis. And our patients during that time can report that they feel like they're not listened to, that their experience isn't taken on board, and that they are made to feel that it's made up, that it's in their heads, that it's not real. Because unfortunately, within the healthcare world, people are often taught, and this is the common phrase that we all refer to, when you hear hoofs, think horses. And within rare diseases, the reason that the rare disease emblem is a zebra is because our saying within rare diseases is when you hear hoofs, think a zebra. It looks like a horse, it sounds like a horse, but it is very different to a horse. So what we want is to bring awareness to rare diseases so that those red flags are recognized earlier, reducing that time for a diagnosis, reducing those mistreatments, reducing the need for invasive procedures, and reducing the need for inappropriate medications. So I am quickly going to play you a video, which I really hope works. I'll just need someone who has a camera on to give me a thumbs up. Sarah, I'm looking at you, or Zoe, thank you so much. If you can hear a ticking clock, the audio does come in louder later, but I just need to be able to hear if you can hear a ticking clock. So I'm hoping this will work. I'm just going to stop sharing that screen. Okay. Ticking.
Looking back, I was lucky with my GP. I described my symptoms and how worried I felt. Fortunately,
The sound went off, Sian. I'm not sure what happened.
Sorry, is everyone's sound gone? Yeah, okay, let me try again. I'll do it from here. Yay, nay? Nope.
Felt. Fortunately, my GP had encountered similar symptoms before, so knew what route to take for further help. When my test results came back, my GP was clear of the next steps and referred me to a specialist. Immediately upon feeling my first symptoms, I saw my GP. But straight away, I felt like my concerns weren't taken seriously. I had some tests, but the results weren't conclusive. I was told to wait and see, and sent on my way to the specialist. I felt a sense of relief. I didn't want anything to be wrong, but if I got a diagnosis, then at least that would be an answer was all I wanted. My GP didn't seem to know what was wrong. They did try to find out, but I was bounced from specialist to specialist for months, none of whom seemed to talk to each other. So I kept having to explain what I was going through, like it was. The first specialist appointment went very well. The specialist ruled out some common conditions before testing for a rare one which had similar symptoms as mine. The specialist got in touch with a clinical centre of excellence who confirmed my diagnosis. It was a relief to know what was happening to my body and the cause. My specialist and I worked through a plan for the management of my condition. I felt in control of what would happen next was very unclear. I had so many different tests, and each specialist examined something new. It was a confusing and slow process. I felt helpless. Chasing my own health information became exhausting. My symptoms were getting worse. Week by week, my symptoms started to improve. With routine visits to a specialist centre, I'm able to manage my condition and have access to appropriate treatment options. My specialist encouraged me to join a support group. It's been such a relief to meet people who know what I'm going through. On a good day, my condition causes very little disruption to my life, is steadily increasing. I'm still not sure my diagnosis is right. Uncontrolled symptoms make work almost impossible, and relationships are strained. Health professional support feels really limited. I need helping me on this journey. A healthcare professional stepped in to coordinate my care. We worked through a comprehensive care plan that includes both physical and psychological support. It's easy to keep track, thanks to their scheduling, and understanding what doctor to go to when and what for became impossible. Hospital departments didn't seem to coordinate my appointments, so I had to arrange and juggle them myself. Eventually, my family had to step in and coordinate. My care relies on teamwork and coordinated management. Without that in place, I will really struggle without access to information and experts who understand my condition. I have some family support, but they can't offer medical answers and solutions. I feel guilty about the impact that this has had on their lives as well as mine.
So I'll just go back to, can everyone hear me again? Yes, wonderful, thank you. So the reason I show that video is because I think it has a great way of showing the experience of both the great experience that the healthcare system can provide a patient with a rare disease, and also one that's not so great. And the experience that is not so great is often the one that's reported to us from our patients and families. Just need to get back to my presentation. Oh, here we go. Skippity-doo-dah down. So that video is actually available on YouTube by itself, and I would highly recommend you sharing that video with your colleagues. It was made with Alexion, the pharmaceutical company, and our friends at Beacon and Medics for Rare Disease and the Genetics Alliance of the UK. So all of that data was from a UK study, but I think it is a very good take on the global picture as well. So we know around the mental health and well-being space within rare diseases that a lot of it is put onto the patients to navigate themselves, especially with the fact that they become the expert in their own care. And unfortunately, with that, the rare disease and stigma go hand in hand, and it can impact the experience of our patients in a negative way. Within health, within rare diseases, 1 in 3 people living with a rare disease have reported that they are challenged by stigma around rare disease, which equates globally to over 100 million people. And to try and put that into perspective of kind of what we know stigma to be and how we see it previously in mainstream media, that is actually 3 times greater than the stigma felt by people living with HIV within the world. So that number of patients with a rare disease that feel stigma is greater than those living with HIV. And we know that there was a huge push within reducing the stigma for people living with a positive HIV diagnosis. So what does stigma do? It's all well and good saying that it exists, but how does it impact our patients? And the way that it impacts our patients is their ability to engage with the healthcare that they need and that they require. And so it creates this inequability, inequality. It puts them into a separate box that people feel like they get put into the too hard basket, that they get pushed from specialist to specialist because no one really knows how to deal with them. And it means that they don't interact with a service because they preempt the fact that they'll be treated like this, which means that they don't receive the care that they are absolutely entitled to. So we need to work around building the education space with rare diseases to then reduce that stigma so that patients can feel safe and supported when they come to our care. But how do we do that? So we've spoken about the fact that rare diseases affect a multitude of areas within a person's life. That means that the model of care has to reflect that. We know and we recognize that there is a huge burden on the patient and the family that is caring for the rare disease. And we know that there are needs across sectors. So when I say sectors, I'm referring to the education space, the welfare space, social services, whichever service your country reflects to support people living with chronic illness or disability. It needs to be able to be supported across those spaces. And we know that each patient with a rare disease is requiring a care coordinator to assist them in managing all of their appointments, managing the communication across those specialists to be able to be all on the same page and working toward the same goal that is beneficial to the patient and their families. And one size doesn't fit all. Every person with a rare disease experiences their rare diseases differently. Their impact will be different, their needs will be different. So it means that the model that we care for them also needs to be different. Now, with rare diseases, obviously it is chronic, it is multi-organed, so it means that our patients are interfacing with hospitals quite frequently. And unfortunately, with those interactions can come a lot of trauma from those invasive procedures that may not be necessary or that are necessary, but are actually in bringing in trauma to that patient because their needs are not met during that time. So what we need to move towards is this trauma-informed care model. So we're recognizing that the person is more than their condition, and we're recognizing that it's not that something is wrong with them. We need to hear their story and what has happened to them. So building that space, building a space that the patient is able to share their story, we need to build in these core principles. And we're talking about the safety. So we're making a space that they feel safe, that it's comfortable, the hierarchy is reduced so that you're on the same page and the same wavelength. We want to create a space that is trustworthy and transparent. So when you're speaking to a patient and you don't know the answer, be truthful and say that you don't know the answer and that you will find it, but make sure you bring that loop back round and you get back to them with or without an answer. But we need to be transparent. We need to create a peer support. So we need to do their care with them. Collaborating with the patient is a core feature of creating that trauma-informed care space. And we want to empower our patients. At the end of the day, we want them to live the best lives that they can. And we need to empower them with positive care coordination and positive affirmation during that appointment, but remaining humble, remaining responsive, and recognizing where your boundary is. So recognizing that you won't know all the answers and that that's okay, and being honest with the patient up front. So in Perth, Western Australia, at the Rare Care Centre, we have created a model of care that is trying to integrate all of those needs that we know that a rare disease patient has. And we have created a model of care that is supporting across all aspects of life. So we're looking at their health. So we have the clinical team, so doctors, consultants, a GP or general practitioner or primary healthcare physician, and the nursing staff. We also have members of the education team. So we have teachers, we have a mental health nurse, and we also have a genetic counsellor who's able to give genetic counselling for patients who have just been recently diagnosed. And it also helps with future family planning as well. And we also have within Australia, it's called the National Disability Insurance Scheme. So that's the funding that's able to be given to patients and families living with chronic disability. And we're able to coordinate that care during their time with us. And so this model is proving to be effective, not only in reducing the healthcare cost, but also to improving the experience of the patient and family navigating the healthcare system. So this model has been written up. We would like and we want to promote this model because our patients are reporting that it is beneficial to them. And you can read up on this model in the journal articles that we've written previously as well. But we're trialing this model because we know that it doesn't just affect a person's life. Rare diseases affect all aspects of life. And so there needs to be a model that reflects that. So we are in a global call to action moment. So since 2021, the UN resolution activated addressing the needs of people living with rare diseases. And then just recently this year in May, the World Health Organization has adopted a landmark resolution for declaring declaring rare diseases as a global health priority, which is giving us a huge foundation to build across, to bring in awareness around rare diseases because it affects so many of our patients. Regardless of whether you specialize in rare diseases, you will care for multiple people with a rare disease. The chances of you having already cared for rare diseases, even if you're not in rare diseases, is exceptionally high. There is no way you will go through your career as a nurse, a midwife, without caring for a rare disease patient. So it is hugely important to recognize the needs of a rare disease patient and their families to better improve their experience during their healthcare journey and to enable them to live the best lives that they can. And so that starts with us. As nurses, we're at the bedside, we're able to listen to the patient's story. And so we have the ability to change that journey for our patients and our families early doors. So that is a quick flash into rare diseases as an introduction. This is going to be the first of the fundamentals series. So there will be other presentations coming in the near future within this space, but this was just a quick snippet on what a rare disease is and the impact that it can have on our patients and why a network like ours is so important about sharing our knowledge and asking questions and supporting each other around the world. So I would like to give everyone an opportunity to ask questions, share thoughts. The floor is yours. So feel free to unmute or type any questions in the chat. And like I said, this presentation will be on our YouTube channel, so you are able to watch it back. I'm a part of the Nursing Network, so you'll be able to find me on the network if you wanted to message me independently. I'll be able to answer any questions after the fact as well. And so I do encourage you to reach out if you have any questions. I'm more than happy to answer anything after today or after tonight. And I just want to take this opportunity to thank you all for coming. I really appreciate your time. I know that we're very time poor, so I do appreciate you all spending the hour with me. For those of you on YouTube and who aren't a part of the Global Nursing Network, please join us. You're able to access all of these webinars live and access all of our education webinars first. And we also have some great opportunities coming up in the Global Nursing Network. So I would love for you to join us as we navigate this space within the network. My name is Sian Gannon, so you can find me on the network if you're there already. And thank you so much for your time. And I hope you all have a fabulous rest of your day. Thank you all so much.